As the mother of a child with laryngomalacia, I hold education of this condition very dear to my heart. There is nothing more exciting than the birth of a baby. However, there are babies born every day with laryngomalacia, and due to underknowledge of the condition, they go extended periods of time without proper diagnosis and treatment. Today I will discuss what laryngomalacia is, what the signs and symptoms are, and what some possible treatment options may be. My hope is that by the end of this speech, you have a broadened knowledge of an under-discussed topic. Laryngomalacia is a complex medical condition present in some infants. Laryngomalacia is an airway defect, also called a birth defect of the airway, that causes the tissues of the larynx to become soft or floppy, which results in noisy breathing. Laryngomalacia is the most common cause of noisy breathing in infants. The laryngeal structure is malformed and floppy, therefore the tissues fall over the airway opening and partially block the airway. The severity of laryngomalacia is ranked by mild, moderate, or severe. 40% of all cases of laryngomalacia are considered mild. In mild cases, you may hear some airway obstruction, but the child will still retain an oxygen saturation level of 98 to 100%. Moderate cases are obviously more severe than mild cases. In moderate cases, there will be clear signs of airway obstruction. You will definitely hear the child breathing, and the child will have oxygen saturation levels around 96%. In severe cases, which is only 20% of laryngomalacia cases, there are very obvious signs of airway obstruction with total blockage of the airway at times. The child could have O2 stats of 86% or lower. Laryngomalacia has many signs and symptoms that may or may not be present depending on the severity of the child's condition. Every child that has laryngomalacia will not present the same symptoms. The main sign is noisy breathing, which is caused by the larynx tissues flapping over the airway. Another common sign of laryngomalacia is difficulty feeding and choking on food. The main concern with choking on food is that they will aspirate that food into their lungs, and it could cause pneumonia. Regurgitation of food is also very common, and it'll be more than your typical spit up. It's going to be more along the lines of projectile vomiting. Acid reflux or gastroesophageal reflux are also very common in laryngomalacia babies. Retractions, which is the drawing in of the chest just below the rib cage, is a very scary but common side effect of laryngomalacia and is more common during a flare, but with a child that had severe laryngomalacia, it could be present at all times. Cyanosis is sometimes caused by lower oxygen levels, and that's just a blue coloration of the skin. Sleep apnea is also another major concern in severe laryngomalacia cases, and sleep apnea is the absence of breath during sleep. There are two main forms of treatment, which include either surgery or non-surgery options. Surgery is only required in a small amount of laryngomalacia cases. It's been estimated that only 3 to 5% of cases need surgery. Supraglotoplasty, which is where they go in and remove some of the extra tissues around the larynx, is the most common form of surgery for laryngomalacia. And again, it's only for infants with severe laryngomalacia that is obstructing their breathing. Surgery will not completely remove the noisy breathing because even though they trim it, they still need room for the larynx to grow, or that tissue to grow as the child grows. But it will decrease the life-threatening risk associated with laryngomalacia. There are many forms of treatments for mild and moderate cases. They may include medication to help control the reflux. Since laryngomalacia typically resolves itself by 24 months of age, sometimes the best treatment is some time. Also, they use keeping the child upright during sleep and eating to prevent any lapses in breath. Breathing monitors or oxygen monitors are sometimes used to make sure that the child is okay during sleeping times. Because laryngomalacia is also associated with failure to thrive and developmental delays, sometimes high-calorie formulas and diets or therapy are needed to keep the child on track. In a small amount of cases, breathing tubes or feeding tubes may be placed to keep the child growing. Babies are born daily, and with a high number of them being born with at least some degree of laryngomalacia, it makes it incredibly important to know about laryngomalacia. Laryngomalacia is a birth defect in which the tissues of the larynx are soft and flop over the airway. Laryngomalacia varies in severity, and the symptoms each child faces are based on the severity of their condition. Treatment is typically non-invasive because most children outgrow this condition by 24 months of age. However, in a small percentage of children, surgery may be required.